Hey, this is Dr. David Wade. We've been talking about posture. We're going to talk about what causes bad posture, how do you change it. When I think of bad posture, I think of the old Tim Conway who's bent forward and shuffling along and they're all jammed up, their joints aren't moving. That's sort of like the end stage of poor posture over time. The joints accumulate stress, they don't move normally, they don't naturally lubricate, they literally burn up, and the word inflammation is the itis at the end of any medical term. You may have heard of sinusitis. The itis is inflammation of the whatever you're talking about. And the word for joint is arthro. So when you combine arthro and itis, you end up with arthritis. So as the joint stays under stress and becomes inflamed because there's too much tension and not enough give in the joint to be able to survive and live and move normally, then you'll end up with inflammation building up. Now, for a long time, we've talked about core muscles, and they are important, but now it seems like the research is more pushed towards posture. One of the reasons is because when a surgeon has to do surgery on a disc herniation, they go into that surgery with the intentions of fixing the problem. But unfortunately, they found in many instances that you're no better off, in many instances worse, having had the surgery. So nobody likes that. The surgeons don't like it, the surgical centers don't like it, and they're actually being graded on the results. And so they've started doing research, more and more research, to figure out why are they having people have surgery and getting bad results, poor outcomes in surgery. Surgery needs to be done. There's a huge herniation putting pressure against the spinal cord and the nerves, and the surgery's got to be done. But how would you like to set it up where you have a higher likelihood of results? What they have found, according to the research, is that the sagittal position, which is the sideways posture of the neck, basically this is the sagittal image, is when you look at the neck from side position. So if you have a forward head posture in that sagittal plane, that leads to a forward shifting of the head. The body muscles and joints begin to have what we call coupled motion. It's like a torquing effect. It's a compressive load that builds up. So if you have this coupled motion from sagittal positioning of the head shifting forward, then, or we call it forward head posture, then you're going to have this coupled twisting. So even if you have a disc herniation and you have to have that removed, if that coupled motion is still present, then you're going to have less than optimal outcomes. So we do a lot of pre-surgical rehabilitation to change the holding patterns, to get the body balanced and to reduce that coupled motion, that twisting effect, because if you're going to have surgery, you want to set it up where you're going to have the maximum success. We also do post-surgical rehab to make sure that the coupled motion continues to stay out, because there are certain reoccurring muscle imbalances that have to be addressed. And the more you learn how to take care of it on your own, the better off you're going to be able to be and stay. And that's sort of what our goal is to get you to be healthy all the way through the age of 100 without having to worry about your body breaking down and the joints deteriorating, okay? So this is Dr. David Wade. Stay tuned. We're going to continue to talk about solutions of what you can do for your posture and how do you keep your body balanced.